New daily average cases peaked mid-January at more than 4,100. Since then, those numbers have fallen to now about 2,100 average daily cases. Hospital leaders say that decrease in cases is of course good news, but keep in mind hospital systems are still strained.
KSHB 41 News reporter Emma James shares the message from chief medical officers.
Folks, here's the story. We are COVID better. We are most certainly not COVID good. And we are clearly not COVID free.
Dr. Stites doesn't sugarcoat it. Healthcare systems around the region are still struggling. Hospitals are seeing COVID numbers trend downward, but they say hospitalizations are still at record highs. An average of 4 people per day are still dying from COVID-19.
We're still not really to the situation where we can take patients in from other hospitals who need our help on a regular, reliable basis without some sort of a time delay.
Doctors say ICUs are still full at many hospitals around the region.
We're still at the 2.7, 2.8 range. That means patients are waiting 10 plus hours for transport. And that's as opposed to what we usually see. If it were normal capacity, it would be 1 to 2 hours, with time critical diseases being less than an hour to move patients out.
While the numbers are going down, doctors say the impact of the strain on healthcare systems will be felt for a long time, specifically with staffing shortages.
Yesterday, we had 48 employees that were out with COVID. That's a nice downward trend, but we're still continuing to see staffing shortages. 37 of those 48 were in a clinical setting, so people not available to be at the bedside to help care for patients.
Doctors say the majority of deaths continue to be those who are unvaccinated. They're asking the community to continue doing their part to fight to end the pandemic and to show kindness to healthcare workers.
Just don't forget about us because we're still here, and I think it feels often like people have forgotten that we're still here.
In Kansas City, Emma James, KSHB 41 News.